everyone, happy Medicare Monday. It's my favorite day of the week. Today we are going to be talking about the differences between HMO plans, PPO plans, and Medigap Policies, which are also known as Medicare Supplement Plans. If you have been following my channel for a while now, you may already know me. My name is Rachel Gajardo. I am a licensed independent health insurance agent. My biggest role as an independent agent is really educating those who are Medicare eligible about what their options are. One of the most common questions that I get whenever I'm working with someone for the first time is, what's going to be the best plan for me? Knowing the difference between HMOs, PPOs, and Medigap policies is very important in determining what kind of coverage might be the best fit for you. Today, I'm really excited to be explaining some of the differences between those plan options. Whether you are on an HMO plan, a PPO plan, or a Medicare Supplement Plan, you do need to be entitled to both Part A and Part B of Medicare before you can enroll into these plan options. So what I want everyone to do is think about these three different options on terms of a scale or a spectrum. I'll be explaining the differences between each of these different types of plans. And just know that I am licensed with all three of these different options, so if a client comes to me and thinks that a PPO plan will be best suited for them, or a Medigap policy will be best suited for them, or an HMO plan will be best suited for them, I'm able to help them on any one of those different options. And that's one of the greatest parts about working with an independent agent. Whatever is going to make the most sense for you is what we can enroll you in. And then of course, if something's ever not working, from year to year, I do help some of my clients switch from HMOs to PPO plans, even to Medigap policies and vice versa. To start off on this end of the spectrum, we're going to talk about Medicare Advantage HMO plans. HMO stands for Health Maintenance Organization. Health maintenance organizations are essentially types of plans where you select a primary care doctor who is basically the captain of your care. He or she then belongs to what we call a medical group or a network. Feel free to check out the medical group video if you have more questions about what that means. But in that medical group, you have a network of doctors, hospitals, specialists, urgent cares, and other medical facilities that would be responsible for overseeing your health care as a member of that medical group. Your primary care physician will then refer you to different specialists who are also a part of the same medical group. On a Medicare Advantage HMO plan, you choose one medical group at a time, and you must stay within that medical group unless it's an emergency. One of the reasons why the Medicare Advantage HMO plans are so popular, especially where I live in Southern California, is because they tend to be more cost effective. Now, it's going to depend on the type of HMO plan that you enroll onto, but many of the Medicare Advantage HMO plans do not have additional premiums that go along with them. What's really nice about these Medicare Advantage HMO plans is that they also include what we call a maximum out-of-pocket. There's a cap that the insurance plan will max you out. If you ever reach this number, then the rest of the year, the health insurance plan will pay for your medical co-payments. The Medicare Advantage HMO plans also tend to include a lot of additional benefits that the original Medicare won't necessarily cover. Some of these benefits include, but are not limited to, vision coverage, hearing coverage. Some have preventive dental, a gym membership. So on this end of the spectrum, we want to think of the health maintenance organization. It's going to have lower premiums, so overall might be more cost effective for you. However, you're a little bit more limited in terms of where you can get your care. I'll explain this more in detail about Medicare Advantage plans in a future video. In the middle, we're going to talk about PPO plans. A PPO plan stands for Preferred Provider Organization. With a preferred provider organization, in-network coverage is covered as well as out-of-network coverage. If you stay in-network, you tend to pay lower copays. If you go outside of network, that would be covered. It doesn't necessarily have to be an emergency like on an HMO plan. However, your share of cost tends to be higher. The PPO plan in the middle also tends to have a higher premium. What you're really paying additional dollars for is to have that freedom and flexibility to go outside of network for a higher share of cost. Now, what makes this a little bit confusing is that PPO plans actually fall under the Medicare Advantage umbrella. So, under Medicare Advantage, there's actually two types of plans. The first we already talked about, which is an HMO. The second option is a PPO. So when people say Medicare Advantage, it's not exclusive to just HMOs. It also includes preferred provider organizations. On PPOs, there are also no referrals. So the HMO plan does have referrals. The PPO plan has a slightly higher premium. Some of the plans tend to not have as rich of benefits, but again, what you're really paying that additional premium for is that flexibility to have routine care out of network. On HMO plans, it's only covered in emergencies. On the PPO plans, they tend to have higher premiums, higher deductibles, higher co-insurances, so overall you could spend more on this plan instead of going with an HMO plan. HMO plans tend to have the lowest cost but the less flexibility in terms of where you can go to get your care. There are also referrals on these types of plans. The PPO plan is in the middle. The last type of plan that we're going to talk about today is what we call a Medigap Policy. It's also called a Medicare Supplement Plan. So if you hear those two terms, they are synonymous with each other. On the opposite end of the spectrum to the HMO is called the Medicare Supplement Plan. On a Medicare Supplement Plan, you can see any doctor or specialist and go to any hospital in the United States as long as they take Medicare, and there are no networks, no referrals. On this type of option, you have the most amount of freedom and flexibility to see any doctor or specialist in the United States as long as they take Medicare. Of course, with this freedom and flexibility, there tends to be the highest premiums that you could pay out of these three different options. What also makes Medicare Supplement Plans a little bit different than most of the Medicare Advantage plans is that they do not automatically include prescription drug coverage. So if you are going to go on a Medicare Supplement Plan, know that you would pay your supplement plan premium, and then you would also pay an additional premium for your prescription drugs. Many of the Medicare supplement plans also don't necessarily offer all of those additional benefits that you would see on some of the Medicare Advantage plans. So the benefits may not be as rich, you are paying higher premiums, but it's because you have the most amount of freedom and flexibility to see any doctor or specialist. So again, we'll think of this as being on a spectrum. On this side, we have the HMO plan, which for a lot of folks tends to be the most cost effective. A lot of these HMO plans do not have deductibles, but remember, on the HMO plan, your medical group would be responsible for coordinating your care. There are referrals on this option, so that's just something to keep in mind. On the opposite end of the spectrum, we have the Medicare Supplement Plan or Medigap Policy. On this option, there tends to be the highest premiums that you can pay. What you're really paying a lot more for in premium is to give yourself the freedom and flexibility to see any doctor or specialist, no referrals required. On the HMO plans, only emergency coverage is covered outside of network. There are no routine visits outside of your network. The analogy that I like to use is if the HMO plan and the Medigap policy got married and had a baby, their baby would be the PPO plan. It has features of both of its parents, but it's kind of in the middle. It's a little bit of both. On the PPO plan, it has a lower premium than a Medicare Supplement plan, but tends to have higher premiums than the HMO plans, so think of that as kind of your in-between. What makes this decision a little bit tricky is that sometimes people think that PPO plans and supplement plans are the same thing, when in fact they are slightly different. And it's very important in knowing that distinction so you can make a very educated decision about which type of policy is going to be best suited for you. Well, I just wanted to thank you all so much again for your time. As always, I'm so happy that you are here. The best way to get in contact with me if you would like to set up your no-cost consultation is to check out my website, which is www.rachelgajardoinsurance.com. My services are always no cost to any Medicare beneficiaries. I'm available and happy to help. Friendly reminder, whether you choose an HMO plan, a PPO plan, or a Medicare Supplement plan, I am licensed with all 3 different options, so I can help you find a plan that's going to make the most sense for you. And just remember, when you do sign up with an independent agent like myself, I am there to service you. I am not just there for clients whenever I sign them up for Medicare, but I'm there to help assist them every single year with whatever questions they may have. Please don't forget to like, comment, and subscribe. If you have any suggestions on future videos, I would really love and appreciate the feedback. I always want to make sure that I'm delivering content that will be useful for people. So again, thank you so much for your time. I cannot wait to see you in the next video.